Have you ever wondered about the impact of medications on our bodies, especially in critical situations? Let's dive into a fascinating case study involving a 64-year-old woman with a history of cardiac disease, multiple strokes, and progressive osteoarthritis. Stay tuned to find out which medication could be responsible for her dangerously low platelet count after knee replacement surgery. Picture this. A 64-year-old woman with a complex medical history is admitted to the hospital for bilateral total knee replacement surgery. The morning after the procedure, her platelet count is shockingly low at 9,000 per cubic millimeter. This critical situation raises a crucial question about the medications she has been taking. As we analyze the options, let's consider the possibilities. Could it be aspirin, known for its blood-thinning properties? Or perhaps Clopidogrel, another antiplatelet drug commonly prescribed for patients with cardiovascular issues? The plot thickens as we introduce heparin, a well-known anticoagulant used in various medical scenarios. Streptokinase, a thrombolytic medication used to dissolve blood clots, adds another layer of complexity to the puzzle. And lastly, we have Warfarin, a popular blood thinner with a long history of medical use. Each of these medications has its own unique mechanism of action and potential side effects. Now, let's reveal the answer. In this particular case, the medication most likely responsible for the low platelet count is heparin. Given the patient's medical history and the nature of knee replacement surgery, heparin's anticoagulant properties could have contributed to this alarming situation. The case of the 64-year-old woman with a critically low platelet count unveils the intricate relationship between medications and our bodies. It serves as a reminder of the importance of understanding the risks and benefits of different drugs, especially in high-stakes medical scenarios. Keep exploring the world of medicine, and remember to stay curious about how our bodies interact with the treatments we receive.